Okay, Kostas, yeah, you can take it away.
Yes, welcome to our webinar. We today with the theme, with topic Cardiovascular Health Innovation Challenge, HealthTech Innovation Challenge, Play for Health. We introduced the winners of the Innovation Challenge, Play for Health. My name is Konstantinos Antipas. I am the coordinator of the BETTEReHEALTH project. And together with today we organize this webinar together with HealthTech Africa, HealthTech Hub Africa. I'm trying to also present my slides now. 1 second. And then we will be very happy to hear from the winners of the competition. To start from presenting a bit the BETTEReHEALTH project and why it's relevant for this to be involved in this kind of activities. BETTEReHEALTH it has been an EU project funded by EU for a period of 2.5 years with 2 million. It was been coordinated by Sintef Digital, which is a Norwegian research organization on which I'm working. It has 5 partners from Africa and 6 from Europe. During this project, we tried to, here it is. Our goal for this project was to contribute to better, more accessible, more effective healthcare in Africa. As you see, the e-health that is, it's not mentioned in our goal because we believe that e-health is not the end goal. Here, the end goal here is, or should be, the better, more effective, more accessible healthcare. And e-health or digital health technology, it's a very powerful means to succeed that. In our project, we didn't develop an e-health solution, an app. So it's a common misconception, misunderstanding with our project that we would do that. Instead, we talk with the important stakeholders of the e-health landscape, and that is the health professionals, the hospital managers, the IT professionals, the policymakers, and see what they think is important for good e-health policy and e-health strategies. Because if you have e-health policies, good e-health policies and e-health strategies, then you can have good e-health solutions. But what we understood even better during the project is that instead of thinking of the patient as the end of this chain or this line, that okay, we will improve this, we will improve e-health so patients will have a better health, you will not succeed in actually having better health unless you put the patient in the middle of the stakeholders and empower them to have a voice in the formulation of e-health policy and e-health strategies, but also in the development of e-health solutions. So if you manage to include all these actors, listen to them, and e-health innovators, startups are also an important, very important part of the e-health ecosystem. Unless if you involve all of them in the formulation of e-health policy and strategies, you will not succeed in improving e-health and as a result improving health in any country, in any continent, but on this project specifically on low and lower middle income countries in Africa. So our concept was that we will look at the different factors that can influence e-health policy and programs. That can be existing resources and evidence, learn from what has happened already, what has gone, good examples and best practices, but also failures. But the other aspect is the human factors, other aspect is the technical factors, the public policy factors. For example, we see that many times the innovators face legal issues, the e-health ecosystems don't have the financial resources or depend too much on international donors, so they don't have healthy ecosystems, healthy and sustainable e-health ecosystems. So we try to look at all these factors and inform e-health policy. A very important work what we've done was to try to involve all the stakeholders, try to give them the understanding and then the relevant knowledge as produced as deliverables in our project to participate in an informed way in the formulation of e-health policy and strategies. And as you see, if you have all these things, you can have better e-health, which can also improve the SDGs in different ways, directly the good health and well-being, but also, very importantly, a healthy ecosystem with good national e-health policies and programs that support innovation, support startups, give room to these initiatives and innovations. Then you can also have can influence the other sustainable development goals as decent working economic growth, industry, innovation and infrastructure, and number 11, sustainable citizen communities. And that's what the webinar today is about. There are several initiatives, and we've seen during our work, been in contact with several startups. We see that there is a lot of potential, a lot of innovative capital here, and willingness people to take the risk and start e-health, invent e-health innovations and work with that. And we believe that based on the project results, we will also contribute to that the African low and low middle countries will have policies and strategies that capitalize, make use of these startups. Our work, our partners, we have, as I mentioned before, we were 11 partners. We've also created 4 regional hubs in Northern Africa, based in Tunisia, from our partner, led by our partner HealthTech SFAX cluster. And also the role of these hubs was not only to involve all the stakeholders in the country, but involve stakeholders from the countries around. And that's what the Northern Africa hub was very good at. We also have the Ghana Health Service leading the Western Africa regional hub. In Ethiopia, we have the Central and Eastern Africa regional hub. And in Southern Africa, we have HIS Malawi leading the Southern Africa hub. I don't remember if I mentioned that the leaders of the Central and Eastern Africa regional hub were Zima University and University of Gondar, 2 academic partners. From the partners I didn't mention that were in the project, it was the Norwegian Center for e-Health Research, also a Norwegian WHO collaborating center, but also very active in national research and international research for e-health. It was the University of Southeast Norway, very active in capacity building, also in African countries. University of Oslo, supporting the HISP network and the DHS2. And we had also Fredrik Levens with us, and also Held Resultat, helping with communication and dissemination. I think that somewhere here, Fredrik, I will stop. You can also maybe say our relationship with this competition and continue the presentation of HTHA.
Yes, thank you very much, Kostas, for this overview and an introduction to the Better eHealth project, with which we have indeed been supporting the Play for Health challenge that was launched by HealthTech Hub Africa. And of course, we will get in a few minutes to the main part of this webinar where we present the winners of that challenge. I will just share a few pieces of information about the International Society for Telemedicine and eHealth, of which I am part and I'm working for. It is a global network of digital health stakeholders. You just see a few of them mentioned here. These organizations, but also many others, are a member in this global network of digital health stakeholders, which represents national associations, institutions like universities, health systems, health centers, but also corporations who provide the technologies and the services, etc. And they all come together in this ISFTH, International Society for Telemedicine and eHealth, to network, to get to know each other, and to, from there, start collaborating with each other, whether it's between businesses and companies, whether it's from academics to business and industry, whether it is between universities and academic institutions or policymakers. So it's a great mix of all these different profiles who bring their own expertise and experience to the table when it comes to knowledge of implementing and developing digital health and also setting up the policies around it. Now, next to this very general aspect of networking, which is, of course, very important, we are also currently working on setting up or developing a number of more specific services. And most of this is really done in partnership with some of our member organizations who have this specific expertise in a number of domains. You see, for instance, here, accreditation of telehealth services mentioned. This is important to assure quality of services. And so we have members like URAC, like the Joint Commission International, who are experts in these areas, and we support them. We work with them on bringing this members and then the wider network so that they might start looking into this and working with these organizations, but also at the level of training, capacity building, which is a topic that Kostas already mentioned. We are currently developing a number of things in partnership with some of our members to provide certain courses that are directed to the workforce to make sure that they are up to speed with, let's say, the latest on digital solutions, on how to implement them, how to use them, how to provide telehealth, teleconsultation services, and so on. We also have a member who is very strong in, let's say, legal, regulatory insights. So all this are things and are services that can be accessed through, let's say, the ISFTH network. Now, very important, of course, in the frame also of this webinar is that we are, let's say, setting up a Better eHealth working group within the International Society for Telemedicine and eHealth. Better eHealth was a temporary project, EU-funded project, and it's always a challenge at the end of such projects to take things forward, because a lot of work has been done, things have been accomplished, things have been set up. But then it's a matter of really continuing that and taking things forward. And so this will now happen through a working group where let's say, the initial partners of the project, or most of the partners, will come together, but where we will also involve new partners, new institutions who are already members of the ISFT network to collaborate and continue to work on some of these issues, like capacity building, like registries of eHealth solutions and eHealth policies that were developed under the Better eHealth project, to continue with all that work. This is just a save the date and a general information about an event, second edition of an event that we will have in December in Silicon Valley, San Jose, California, Global Connections for Sustainable Telehealth. So an invitation to all of you. And of course, also an invitation to look more closely at the International Society for Telemedicine and see if this might be something where you may also want to become a part of, may want to become a member. And these are the contact details. And so with that, I would like to pass on the floor to Belize from the HealthTech Hub Africa to provide some background on their activities and of course also on the Play for Health challenge and the other challenges that they have been running. And then once Belize has presented, we will come to Bethel and Nelson, the actual winners of the Play for Health challenge, to present their activities. So over to you, Belize. I'm sorry.
Thank you so much, Frederick. I'm really excited to be here and to talk about all the wonderful work that we're doing over at the HealthTech Hub Africa. I will try and share my screen right now. Please let me know once you can see it.
Yes, we see it. Perfect.
Yes, see it? Okay, great. Again, so the HealthTech Hub Africa is accelerating health tech innovation in Africa. And we are here to catalyze a collaboration between startups and governments on data and technology-enabled innovations that strengthen health in Africa. The HealthTech Hub Africa has been in existence for the last year and a half. We officially launched in December of 2021 and have had 2 cohorts that I will talk a little bit more about in a few slides. The HealthTech Hub serves specifically 2 purposes. It's trying to solve 2 challenges, one for governments and one for the startups. For the startups and entrepreneurs in general, health tech startups face major barriers in lack of skills, resources, funding, ecosystem partnerships, and oftentimes their innovations aren't able to reach fruition due to those challenges. And governments, on the other hand, have varying levels of maturity in data and technology-enabled policies, and oftentimes aren't able to find fit-for-purpose tech solutions to address the challenges that they're facing. So the HealthTech Hub essentially comes to become serve as a convening platform for both governments and entrepreneurs in health tech, so that they can have a place to convene and co-create solutions for existing challenges on the continent. The HealthTech Hub Africa is a Pan-African impact-focused accelerator program, and we aim to achieve 3 main things. It's to deliver impactful health tech innovations driven by data and generating evidence on reducing health inequities. We aim to be a platform where health tech innovations can be launched from. And we also strive to work alongside our government partners to inform forward-looking policies on data and technology in health. Our 3-year aspiration is to accelerate at least 120 health tech African companies to raise 50 million plus in funding for African health tech companies, and to create more than 1,200 jobs and positively impact more than 3 million people. And also work with policymakers on informing forward-looking policies, as I mentioned, and create partnerships that strengthen all the above-mentioned points. The HealthTech Hub is a partnership, it operates a partnership model with the anchor partners being the Novartis Foundation, the Global Fund, the Patrick J. McGovern Foundation, and the Norskin East Africa. The catalytic partners are the ones you can see here: Government of Rwanda, Government of Senegal, and new partners that have been onboarded recently. Our implementation partners are Bridge for Billions, Impact Hub Dakar, Center for the Fourth Industrial Revolution, Rwanda, and we have many of in-kind partners that contribute to the vision of the hub. The strategic pillars for the hub are 5, and they look at both sides, as I mentioned, that focus one the entrepreneurs. Well, the two pillars that mainly focus on entrepreneurs are the cohort design for the Innovation Acceleration Program, which lasts 4 months and is meant for 40 growth stage, 40 startups, 30 of which are growth stage and 10 are scale-ups. And the model that we use is a hybrid acceleration model, so the startups can benefit from the offerings of the hub from their location, or they can be in Kigali where they can still follow the course of the program from there free of charge at the Norsken House, Kigali. The other pillar of the hub is funding for use cases in public health. The HealthTech Hub has offered more than $1.2 million in grant funding for HealthTech innovation fast-tracking projects, which we'll get into a little bit in more slides, and what the Medtech and WeCare is going to fall in and discuss. We collect learnings from the public fast-tracking projects, and we're collecting them and putting them into a blueprint that can be used to socialize the learnings we've received from the innovation challenges that we run throughout the year. And we also have a public-private partners network that is meant to be a connector of all the other pillars through in-kind support, financial support, and mentorship, as well as expert sessions. The thematic areas in which the four thematic areas in which the startups that are part of the hub fall under are cardiovascular health, breast cancer, virtual health and care, and optimization of data-driven decision-making. One startup can fit in any one of those categories or cut across a couple of them. The innovation program that I mentioned that those startups benefit from is split into 4 main sections. The first part is the innovation program itself, in which the startup follows a structured business model innovation that was developed by partners over at Bridge for Billions. Throughout that process, they have expert sessions that are ongoing, and they also benefit from mentors. The next phase is the investment readiness phase, where they work with our partners over at VC4A to become more investment ready, and to they receive master classes that can help them in areas that they've highlighted to be of importance to them. We also have health tech summits that happen throughout the year, as well as meetups, which are essentially convenings for members of the health tech community or healthcare in general, be it investors, funders, startups, practitioners, you name it. All the stakeholders involved in health tech are always welcome to all of our events. And in fact, we have an upcoming investor summit that if you're listening to the webinar, please go over to our website and sign up and come and look at the work that the amazing HealthTech Hub Africa startups have achieved in the last year, and hopefully invest in any of the solutions that they have. I will skip quickly through this and focus a little bit more on the categories in which the health tech startups fall, or the solutions that they have come up with fall. You can see that the majority are within health tech apps and platforms. Many focus on artificial intelligence in healthcare. Quite a few are in telemedicine and electronic health records, as well as health data analytics. The rest are a bit less, but you can see interesting startups, so you can find them in medical imaging technology. The spread of the startups in the hub is, as you can see in this map, with the highest number of startups being from Nigeria and from Kenya. Some of the impact figures that we were able to collect from last year were beneficiaries reached by the collective number of startups, which was about 1.3 million. Total funds raised during the 2022 cohort program was 14.3 million. And this is funds that are both grants, loans, or investments of other kinds. There was 277 jobs created. Can now go into what we're mostly all here and interested to hear more about is the fast-tracking innovation projects. So as I mentioned, this is a pillar of the hub, and the reason this pillar exists is because Africa faces a significant health challenge of over 22% global disease burden and only 3% of health workers. And we thought that the goal of fast-tracking health tech innovations in public health system would be to identify and catalyze technology solutions that can address Africa's health challenges. And so we can use our processes and learnings to be documented so that it is easier to replicate these solutions across the continent instead of starting from scratch each single time in each nation. This is kind of the high-level approach that we're looking at for the fast-tracking projects. Conduct landscape analysis to looking into innovation areas that fit health system needs. And we do this along with our government partners who then, following the landscape analysis, will look into the regulatory frameworks and identify policy barriers. And through ideation and co-creation sessions, research pain points and government priorities are aligned, and a challenge is launched. The startups share what they think the best solutions to those challenges can be, and the selected startup then tests the instruments and recommendations through fast-tracking projects for public health to refine innovation and are used in public health systems. And through that project, the startup is able to validate and integrate it or even scale its solution, which I'm sure Nelson and Bethel will talk a little bit more. So let me not focus too much on that and give them the room to discuss how their projects will fit into that. Looking at some of the challenges that have been launched, we have supported startups through innovation challenges with about $1.2 million in funding. We had two main startup grants given last year, $250,000 and $300,000, given to Lifespan and Bamtu in Senegal and Rwanda, respectively. The top 5 startups that are part of the cohorts are given awards with ranging values. And the ones from last year, from the 2022 cohort, you can see are Clara, Medtech, Afia Pharma, and Lifespan. And for this year, the top 3 startups received grant awards, and it was Yena Health from Ethiopia, Doctors from Kenya, and Jake Med from Cameroon, who are all implementing amazing projects that we can talk about in maybe another session. And for today, we're looking at the 2023 grant awardees for the Play for Health Challenge, which is meant to increase healthy living options for school children in Africa, to decrease complications for today, to decrease complications for tomorrow. Here we'll have Medtech and WeCare, and I will leave the floor to them to talk to you about their projects and how this experience has been overall. And just to highlight some of our other challenges that are ongoing in 2023 is the optimization for data funded by the Global Fund and the AI for Health by the Patrick J. McGovern Foundation. So thank you, and I look forward to hearing more from Medtech and WeCare. Over to you, Nelson.
Yeah, well, thank you very much, Belize, for this overview of the wonderful work that you are doing at the HealthTech Hub Africa and the challenges that you have launched already. One of them and concluded also, and one of them was indeed the Play for Health challenge. So we're very pleased today to have with us Bethel from WeCare and Nelson from Medtech Africa, who won that challenge. So I would like to hand over to Bethel from WeCare to present their activities and what they are doing in e-health. So over to you, Bethel.
Thank you, Frederick. Is my screen visible?
Yes, it's perfect. Go ahead.
Thank you. Thank you, Belize. So as it has been presented earlier, WeCare is part of the second cohort of HTHA. It has been an interesting journey since we have joined the cohort. So we were able to manage and win one of the challenges which was offered through this group. So this was a Play for Health challenge, a cardiovascular project. So WeCare is a digital health, and we are visioning to enhance healthcare availability using contemporary technologies. So as many of the African countries, so this is one of the reality of urban Ethiopian healthcare system, where people will be waiting for long lists to have a medical care. So this is one of the reality that we are trying to solve. It's not only for the urban ones, but also for the rural parts of Ethiopia. So why our solution? So as you have seen in the earlier picture, there is a low accessibility of healthcare. And then unfortunately, and there is a high unemployment rate of healthcare professionals in Ethiopia currently. So we are trying to merge the available resource of healthcare professional with the inaccessible healthcare, so that our platform will be a bridge between the clients and the healthcare providers. And we are trying to also involve in the health management system so that we can have an updated and integrated health management and documentation system, which will be assisting the whole nation so that people can have their e-health records wherever they went. So the other thing that we are also working on is the poor health seeking characters of our nation. So we use our social media platforms to teach our clients and patients what signs and symptoms could be, which types of disease, so that we are trying to increase the health awareness rate of our society. So in Ethiopia, we have one of the largest population in Africa, next to Nigeria, which is 100 million people. And then we have 72 million people using mobile phone. So this is a huge market that we can embark on. And among this, 20 million of them use smartphones. So this 20 million people are a target for the application users, but at least 72 million people have access to mobile phone where they can reach to our call center, which works 24/7. We have 16,000 doctors throughout Ethiopia with more than 380 hospitals and more than 4,000 private clinics. So in the near future, we are planning to integrate this setup so that people can easily see where they can get the service easily. So our platform offers for our clients to search healthcare professionals, depending upon their locality, the condition of the treatment they would like to have, or the location of the hospital or the clinic. They can select the professionals based on the available rating or system, or if they know them, or practical locations of the people or the service, and then they can book in clinic or an online consultations immediately on the application. We have also offered our healthcare providers who are not employed anywhere else to use our office clinic to visit when the patients would like to visit. So we have offered our patients a solution, and the healthcare providers have also a place to evaluate their patients if there is a need for a physical examination. So the current solutions that we are providing, so we have the telemedicine solutions, which is based on our application and website booking platform. So the application has two applications, for a patient and for partners or for healthcare providers. So people can book their service on the application or on the web. And our call center works for 24/7. We use a toll line 9394, and we provide health consultations from anyone who called to our call centers. And then as you have seen earlier in the picture, for anyone who needs an in-person visit, they can visit our office consultation. And we have also a home-based care service where we send our healthcare professionals to the homes of the customers so that they can have the healthcare service accessible from their homes. So since we have been launched in 2021, it's only 2 years, we have managed to have a large market, the largest market share in Ethiopia. We have currently 2,700 healthcare professionals registered on our platform, and we have more than 40,000 users. So the number of application booking is 2,600. As you can see, this is a small number since we have limitations in the internet connectivity, but we were able to host more than 26,000 calls through our call center where people can still get their consultation. And we have a social media platforms. We have more than 105,000 followers, which we use it for health education purpose. So these are our sister companies and working partners. So we have also won one of the JICA, the Japan institutions for HealthTech Innovation. So we have won one of the challenges also on the JICA platform. So why Play for Health challenge? Why are we interested in this challenge? So this challenge is aiming to increase healthy living options for kids, school children in Africa today, to decrease the cardiovascular complication rate in adults. So as you can have heard from many presentations, non-communicable diseases are also one of the highest health concerns in Africa. The same is for Ethiopia. So non-communicable disease is one of the leading causes in Ethiopia. And then among the non-communicable disease, the cardiovascular disease takes 42% of the share. So you can see the huge burden. And this Play for Health challenge targets the age group from 1st to 7th grade, which is children less than age 14. And in Ethiopia, we have 52 million of those children. So this is a huge challenge that we should be able to tackle. And then if we have a good track record, so you can see that we will be able to impact the future nation of the Ethiopia. And we have also a childhood obesity rate of 11%, and nearly we have 2% children with rheumatic valvular heart disease, which is still a preventable one. And then this also aligns with the national strategy of Ethiopia. So Ethiopia's Ministry of Health has planned to reduce non-communicable disease by 1/3 in 2030. So Play for Health challenge directly aligns with the nation's strategy and with the nation's health burden that we are trying to solve currently. So healthy learners learn better, and that better educated learners will enjoy healthier life. So that is one of the motives that we would like to see in this project implemented. So the proposed project, it was already implemented starting from 10 years back in South Africa. So it is an impact proven. It's not something that we are trying to prove. And then, as you have seen in the previous slide, this has a fit to need. So we had the need that this project will be applying to Ethiopia. So exactly fits the need that we really would like to solve. And then the additional things that we are planning to do is contextualize it to the Ethiopian children setup. So we are planning to have this platform as a Neko Lejoch, which means unactive kids. So we are planning to integrate this as a subdomain in our website, and we are preparing teaching aid materials for school teachers so that they can support school children in their schools to be more active and more healthier lifestyle. So we are planning to have animated audiovisual presentations, integrated screening tool so that we can pick those children with high risk factors so that we can link them to the proper health channel so that they can be followed. And we are also planning to support this high risk children to have virtual follow-up with our cardiovascular pediatric cardiologists. And we are trying to create character musca so that children can engage in many playful activities, which makes them physically active to prevent their cardiovascular risk. So these are the things that we are planning to create. And if possible, we will also add fitness competitions and tournaments in the schools and beyond. So the project outcome is to see 100,000 actively engaged beneficiaries, which are the school children, and 300 schools. And the number of volunteers we're going to have will be 1,000. This could be school teachers and parents. Number of positive testimonials we will be having will be 5, and we will have a number of signed partnership, at least with 3 institutions in the country. So beneficiaries with behavioral change are expected to be 10,000, and beneficiaries with BMI are expected to be 2,000. So this is Play for Health Challenge. It's not only being about physically active, but it has also its own run on nutrition and health care teaching activities. So we are expecting to have people changing their diet habits and then the way they keep their hygiene also. So these are the project stakeholders. We will be planning to implement it with the Association of Ministry of Health, Ministry of Education, Ministry of Innovation and Technology of Ethiopia. We have a nutritionist with our team. And as you can see, we have Novartis Foundation, which is our major funder. So this far, we were able to produce the content for the school children, so that will be prepared in a books and audiovisual production that will be easily implemented. That will be easy for the school children to follow from their teachers. And this is our team, which will be involved in Play for Health Challenge. So we have software developers, cardiologists, both pediatrics and adult. We have nutritionists, educational consultants, sports science instructors, and the WeCare team, who are physicians. So our sustainability plan to make this project more of sustainable, we are planning to have B2G and B2B model. So in B2G model, we are going to gain endorsements from Ministry of Health, Ministry of Innovation, Technology and Education. And we are planning to include Ethiopian Public Health Institute. And in the B2B model, we are planning to directly sell of these teaching materials for subscription based to the private medical, for the private schools. So the current funds that we have got is totally from Novartis Foundation, which is 125,000 USD. So we are planning to use nearly half of the fund for the teaching aid development and integration. The rest of the fund will be for training of teachers and events and monitoring and evaluation of the project. So the best way to predict the future is to create it. So I will borrow this statement still again from President Obama, the previous American president. So I think we are at the right time where we can predict the future. So anyone who is interested, we are asking to join us in this revolution so that we can have a better health adults tomorrow, so that we can create it today. So invest in our vision, partner with us together, and we can reshape the future through the power of technology. And thank you. That's all.
Thank you very much, Bethel, for this wonderful overview of your overall telemedicine solutions and services, and of course also of your Play for Health proposal, which, well, as we know, became one of the winners of that Play for Health challenge. So congratulations again on that, and also from our side with the BETTEReHEALTH partners and team, and now being sort of integrated and taken forward in the international society. But telemedicine and e-health, we definitely look forward and hope to also collaborate with you and hear more from what you are doing. And then I hand over to Nelson from Medtech Africa, who were the other winner of the Play for Health Challenge. So over to you, Nelson, with more information on Medtech Africa, what you are doing and what you have been proposing to the Play for Health Challenge. Okay, we see your screen, Nelson. I'm not sure if you were already presenting. We didn't hear you. Nelson, can you hear me? We don't get any sound from your side, but we can see your screen.
Can you hear me now?
Now it's okay. Yeah, we hear and see you. Please go ahead.
My name is Nelson, CEO and co-founder at Medtech Africa, and it's my pleasure to introduce to you what we do at Medtech Africa and how we are building a project around cardiovascular health for both the adult population and, of course, the Play for Health project. As generally known, cardiovascular disease is the leading cause of death globally. In Nigeria, over 20 million persons have experienced cardiovascular complication, either stroke or hypertension, in the last 4 years. And this means we are seeing a huge growth of cardiovascular complication, over 150,000 deaths in Nigeria. And we have 80 million persons out of the 214 million population that are hypertensive, and this is a huge poison. And if you take a look at the ratio to cardiologists available in the country, which is just 500 cardiologists, so the burden of persons with this condition is over 1 to 400,000 cardiologists to be able to handle this case. So we built a solution to be able to address this, because one, out of the 80 million persons with this condition in Nigeria, over 53.4 million persons are unaware about their conditions, meaning over 53.5 million they are living with hypertension or diabetes or waiting for an accident to happen. And I will share an experience of someone who was part of this persons in this population, a neighbor, which I'm a close friend who had hypertension but undiagnosed. And later on, it became a partial stroke. She went for treatment, and along the line, she couldn't be able to manage her health, and she died. So 53.5 million persons are like her who don't know they have this complication. And we've seen data showing that over 100 million persons are going to have either one cardiovascular complication in the next by 2030. And we're seeing a growth in 1995, we've seen over 75,000 persons having complications. And in 2023 today, we are hearing 80 million persons having cardiovascular complications in Nigeria. This is a big burden. It is growing and it needs to be tackled. So we built a solution, a medical platform, along with medical solution app to help doctors improve health monitoring and provide screening. So we focus one on screening, which is early detection for management, providing a solution where people can be able to get to the nearest point of care to get screened for this complication or provide home screening to these people. And we've been able to provide over 46,000 screens directly to users who are hypertensive and or diabetic. And one of the key things we focus on beyond just screening is to be able to strengthen the hospital care system for management of cardiovascular diseases, because we understand that the ratio and the burden of people with this complication with the caregivers is significantly low and the burden is high. So we have to look at a solution that is able to help streamline management of patient care. Imagine a city like Lagos, wherein you have to spend 4 to 5 hours on traffic and someone who is hypertensive. We decided to build a solution where we can able to streamline care, where patients with the most needs are required to come to the hospital and provide tools for doctors and cardiologists to be able to provide remote monitoring option, providing one adherence to drugs, medication, or providing remote monitoring of their vitals through connected devices, home run, the Fitbit, Apple. So we streamline this data directly to the hospital system, connected to the hospital EMR software to be able to help them improve the health of their patients. And we don't just stop there along the way. We provide care all the way, help doctors to be able to effectively manage their patients. And also we look at for elderly care, people who are not smart, tech savvy. We provide authorized third-party notification wherein their child or their grandchild can be able to help them manage their health, to remind them when they are defaulting on taking of their medications or their drugs. And our product is used by the #1 cardiovascular care clinic in Nigeria, Living Health, and it's a big boost for us because it's a big need for them, and we are working together with them to improve the system to go to help patients with need. For the Play for Health project, our work on kids or within 5 to 17, there is a huge burden. Research by the Usman Dafodio Teaching Hospital shows about 54% of children exhibit a risk of cardiovascular complication. And in Nigeria, over 80% of the population are young adults. It means we are waiting on a crisis that will happen if we don't tackle this. And this presents the opportunity that aligns with the Play for Health goal, the initiative through the Novartis Foundation and the HealthTech Hub, wherein this is a crucial time to be able to address, 1, the educational gap, 2, to screen for risk factors, to provide palliative to be able to manage people with poor life choices and people that have high risk factors. In Nigeria, in the school system, we have over 35 million students already receiving care from that getting education from primary or secondary school in Nigeria. And we are looking at to address this need, focus on this care. So the Play for Health project promotes healthy lifestyle, focused on screening, exercise, and education. So we want to be able to provide early detection, help with exercises to be able to improve their cardio, and also educate them on the knowledge and risks associated with cardiovascular complication and how to avoid it. Because as a popular saying, prevention is better than cure. So our goal for this project is to be able to target 220,000 students in primary and secondary school in Nigeria, taking advantage of instructors, 120,000 instructors. These instructors are recent graduates. In Nigeria, we have a 1-year youth service scheme wherein recent graduates are forced to provide national service to their community and to the country, wherein they are posted to schools to either teach or posted to hospitals with their health workers to provide care for 1 year. And we're taking advantage of this network of educators, tech savvy. They have devices, they are educated, they are learned, they understand the care, the need for this care. So we're taking advantage of them to be instructors for this project around 220 schools in 4 states in Nigeria. And we just stopping there. just the students. We want to also empower teachers on lifestyle choices, on how to be able to improve their health, on how to be able to educate other students, even when the project terminates or when it's integrated into the curriculum, to be able to improve their health. And we provide what's called a comprehensive assessment tool,
Nelson, yeah, the sound is just breaking up just a little bit. Maybe, yeah, if you come a bit closer, or not sure. Yes, it all of a sudden it started getting a bit broken. We still hear you, but not in a fluent way.
All right, can you hear me now? Is it better?
Yeah, this is better again. Okay,
all right.
Thank you.
So we provide a mobile app for kids that is interactive, provided included with cartoon characters, video content, interactive guides that can able to help them to take screening on their face to check their nutritional health, their cardio status, and also a self-motivating app. And we provide a system wherein they could be able to improve their health, learn about nutritional health, cardiovascular health, and also gain text from partners like educational platforms, get access to quiz and other tools to be able to improve their health. And for the teachers, as mentioned earlier, we're providing lifestyle training for teachers to give them access to content that's going to improve their health, or content on exercises, or conducting physical assessment, learning about risk factor, how to manage hypertension, how to manage diabetes, and also mental health, because this is important to be able to pass this knowledge, not just to the students, but for the teachers along the way. And the acceleration project will focus on 4 states. We are mainly Oyo State, Lagos, Port Harcourt, and Abuja, which is strategically positioned to go for help us to be able to get access to real insights on how to improve the student health. And one of the key things we're providing medical and sports kits to be able to assist in the course of this project, focused on both the private and the public school to provide equity for all students across the 4 states. And so far, we've received 3 supports from three state governments who are willing to look into the project with us, including working closely with our partners to be able to add this into the school curriculum, because one of the things is that there's a value gap of knowledge around cardiovascular. This is why we're seeing in the population from 75,000 in 1995 to 18 million today in Nigeria. So we're looking at working closely with these partners, and we are excited working with them. And the other key partners, of course, the Novartis Foundation, which is funded by them, the HealthTech Hub, and also the Federal Ministry of Health, which is the key pioneer for this project that we're working with the harness, and also look at what are the insights that we're going to look at for while screening, and what are the content that in terms of local context for the Nigerian population to be able to pass the message better for them. And we are happy to work closely with partners like Better mentioned, the Kazi Bantu Health Challenge has been done in South Africa years ago. And one of the key partners was the Swiss Tropical and Public Health Institute, which work closely with them. And we want to work on a solution that is proven already, which is why we're working closely with the Swiss Tropical and Public Health Institute to look at methodologies and ways to be able to better deliver this project. And as mentioned earlier, we work with key partners, educational partners, wherein they want to provide text, because one of the things is to get students excited about this. To perform some heavy challenge, what do you get to gain? So they get access like text, quizzes, preparation for exams, winners of challenges, which are weekly and monthly challenges, get access to this. And we also work with these educational partners, providing 10 seconds edit videos, who will be run as ads on their platform for people, even those who are not interested in the project. We can get to learn about how to also improve their health and get the general knowledge about cardiovascular health. And we don't stop there. Nigeria is a very active young population driven by music and dance, and we take advantage of this. Afrobeat dance, we want to drive participation through TikTok challenges, which is one of the things driving engagement in the country. And we're looking at taking advantage of TikTok challenges where winners can also get access to tech and prizes. The project, which already commenced, due to end by March 2024, we're ending with a conference that will be headlined also with the Federal Ministry of Health and other partners to be able to give outcome on whatever we've achieved and lay a strategy, which publication will be released on what we find, the findings we've seen, how the project has been able to impact the students' health, and we release it for the public. I'm not working. I work with a team that are very experienced, that understand the terrain. One of the key persons working with the cardiologist, military cardiologist who has experience, over 59 years experience, bringing his insights to what we are supposed to work into and what we are supposed to look into to improve the health of the population of children in Nigeria. We would love to have a chat with anybody interested in what we are doing and learning more on how we can be able to collaborate to build and also make this project a successful project. Thank you.
Thank you very much, Nelson, and also congratulations to you and then Medtech Africa for being one of the Play for Health Innovation Challenge winners. We definitely look forward to hearing and seeing more from you and from Bethel and her team about the results and outcomes of this project and how everything will be taken forward and what the results will be. I encourage everyone listening in on this webinar and the recording to definitely check out these two companies, WeCare and Medtech Africa. And as Nelson was saying, to get in touch with them to see how you can collaborate. I also encourage you to check out the HealthTech Hub Africa and their ongoing and past and future innovation challenges, but also all the other activities and events that they have going on. Very worthwhile to participate in and to join. And then, of course, I also encourage you to look at and get in touch with us at the International Society for Telemedicine and eHealth, where, as you will have heard in the beginning, we are now also taking forward what was started up under the BETTEReHEALTH project, and where we will be setting up a working group within the International Society for Telemedicine to look at e-health and telehealth developments and implementation in Africa, but also more widely in regions, rural regions, regions with healthcare disparities, etc., and see how we can bring stakeholders together to collaborate on more and better e-health, with, of course, the ultimate aim of creating better health access, better health services for all. So that was it for this webinar. Thank you to all our presenters. Congratulations again to the winners of the Play for Health Challenge, and do not hesitate to get in touch with us, with any and all of us, for any further questions that you may have. So thank you to all, and we look forward to seeing you at the occasion of a next webinar or event.
Thank you, Frederick.
Thank you all very much.
Thank you so much.
Bye-bye.